Dr. Joe, a medical program where we discuss various health issues affecting humanity at large. Today, our focus is on hypertension or high blood pressure or simply BP. Hypertension is a medical condition that affects the arteries that carry blood throughout the body. What happens when you've got hypertension? The definition is simply a systolic blood pressure of greater than 140 millimeters mercury and a diastolic blood pressure greater than 90 millimeters mercury. By systolic blood pressure, we mean the top blood pressure, and diastolic blood pressure is the bottom blood pressure. If the top blood pressure is greater than 140, it means you're suffering from high blood pressure or hypertension. If the bottom blood pressure is greater than 90, it means you're suffering from high blood pressure or hypertension. If one of them is high and the other one is normal, it still means you're suffering from high blood pressure. If the top one is the only one that is elevated and the bottom one is normal, we say it's systolic hypertension. If the bottom one is the one that is elevated and the top one is normal, we say it's diastolic hypertension. So either way, you've got hypertension. If both of them are elevated, it's still hypertension. So a blood pressure greater than 140, greater than 90, the bottom one greater than 90, the top one greater than 140, it's hypertension or simply high blood pressure. High blood pressure affects up to 37% of people. Between 16 to 37% of people are affected by high blood pressure in their lifetime. That's a significant number because if you convert it to numbers, it turns out to be more than 2 billion people worldwide are affected by high blood pressure or hypertension in their lifetime. And we say the causes of hypertension, they are variable. The first one, we call it essential hypertension or primary hypertension. This one affects 90 to 95% of individuals who've got high blood pressure. By essential or primary hypertension, we mean the cause of the hypertension is not known or it's idiopathic. So this is the commonest type of blood pressure. The second one is called secondary hypertension. Secondary hypertension is hypertension that is secondary to other causes. Common causes of hypertension are diabetes mellitus, renal artery stenosis, renal diseases. Any form of renal disease can result in high blood pressure, or peripheral vascular diseases can result in high blood pressure. So when you've got diabetes mellitus, when you've got kidney disease, when you've got peripheral vascular disease, you be on a high alert of suffering from high blood pressure. So these are the main types of high blood pressure. We go further to demarcate a high blood pressure depending on the extent of the high blood pressure. If you've got a BP of, say, systolic between 120 and 140 and diastolic between 80 and 90, it's not necessarily hypertension. We call it pre-hypertension. At this point in time, we need to start monitoring you very closely. Then when your systolic goes beyond 140, if it's between 140 and 160, diastolic between 90 and 100, we call it stage 1 hypertension. This is the early stage of high blood pressure. From there, if your systolic goes between 160 and 180 and your diastolic goes between 100 and 110, that means now you're in stage 2 hypertension. If it goes further, from above 180 systolic, the top one is greater than 180, the bottom one is greater than 110. It now means you've got stage 3 hypertension. Stage 3 hypertension is further divided into two. We call one hypertensive agency. Hypertensive agency is stage 3 high blood pressure, that is BP, that is greater than 180, top one, bottom one greater than 110, without complications, with no end organ disease. That is hypertensive agency. Then if you've got end organ disease, say if you had a stroke, you've got heart disease, you've got kidney disease or liver disease, we call it hypertensive emergency. This is now advanced. Usually with this one, you've got complications already and you need to be admitted and attended to urgently. So these are the main subtypes of hypertension. Thank you for watching the first episode of Dr. Joe. Join us after the short break as we go further to discuss hypertension. Welcome back to the second segment of Dr. Joe. Today we're focusing on hypertension or simply high blood pressure. We've spoken about the definition of hypertension and the classification of hypertension. Now we want to look at the etiology, the causative factors of hypertension. We touched them briefly in the first segment. One, the causes of BP, if it's primary hypertension, are not known. The causes of primary hypertension are not known, and we said this affects 90 to 95% of individuals. Then secondary hypertension, the causes are generally known, e.g. diabetes mellitus, e.g. peripheral vascular disease. Now, let's look at the pathophysiology. How does one get to develop hypertension? Is it a problem in their abdomen? Is it a problem in their chest? What exactly is hypertension? What exactly causes the hypertension? Okay, what happens is there are two things that control your blood pressure. One is the heart, the rate at which the heart is pumping and the force with which the heart is contracting. Those two result in what is called cardiac output. So it's effect of cardiac output and what is called peripheral vascular resistance. Depending on how resistant your vessels, peripheral vessels, your arteries are to the pressure with which the heart is pumping blood, you get hypertension. So simply put, the main factor that we look at is peripheral vascular resistance. Peripheral vascular resistance is the resistance against blood flow that your arteries will be exerting. Generally, what happens is when you are now hypertensive, there is deposition of fat in your blood vessels that results in stiffness of your blood vessels. Arteries generally should be elastic. Your body has got a capacity to do what is called auto-regulation. By auto-regulation, what happens is when the BP goes up, your blood vessels will vasodilate, they increase in diameter and bring down the blood pressure. But when you're now suffering from hypertension, your vessels have lost that capacity because of fat deposition in the muscle layer of the blood vessels. So once there is that fat deposition, it means your blood vessels tend to become rigid or non-elastic. When they're inelastic now, that's when you suffer from hypertension. The problem is once this happens, there is no reverse. There are no drugs that have been invented. There is no medication that has been found so far that can reverse the damage on the blood vessels. So once the damage is occurred, it's permanent. Because of that, we put you on medication, and once we put you on medication, you need to take the medication for life, because none of the medication that we give currently are curative. That means they can cure your BP so that you stop taking your antihypertensives. So once we put you on antihypertensives, you need to take them for life. Let's go a bit further and discuss what exactly will be happening once your blood vessels are constricted. Once they are constricted, that means peripheral vascular resistance is increased, and that means your blood pressure is gone up. And once that happens, the damage is permanent, and it can happen in any part of your body. It can happen from the brain, from the head, going all the way down to the toes. Once you get that complication happening, you've got problems. Now, when it comes to the signs and symptoms of hypertension, I need you to know that most patients who are hypertensive do not have any complaint. They have no sign or symptom. That means hypertension will just give you problems, you'll be suffering from it, and yet you won't have any symptom. That's why it's got its alias, the silent killer. That's why you call it the silent killer. When you now have symptoms, it means something has gone wrong. Some people will be saying, I can feel when my BP has gone up, I can feel it because I have a headache or I feel like this. But to be honest, you can't tell when your BP has gone up. The only way you can tell when your BP has gone up is by measuring your blood pressure using a sphygmomanometer. Without measuring your blood pressure, you can't tell, and you will never know whether your BP is normal or elevated. So once you start having symptoms, remember, it means something is already going bad. Some of the symptoms that people suffer from when they've got hypertension include headaches. You could just have generalized body weakness. You could just be feeling tired, easy fatigability, just get fatigued without doing much exercise or doing much work. Some people just get lazy. It can also be a sign of hypertension. Then there are complications that come because of hypertension. Let's start from the head going to the toes. From the head, the major complication that you can get is called a cerebrovascular accident, or CVA, generally known as a stroke. When you get a stroke, what happens is you bleed in the brain. If you get a bleed on the right side, you'll get weakness on the left side. If you get a bleed on the left side, you get weakness on the right side of your body. So that's what happens with a stroke. Usually, there is a bleed because the pressure with which the blood is moving in your brain vessels is very high, and then you get a rupture of one of the vessels, then you get a stroke or a CVA. Then going further down, when you come to the eyes, there's a part of the eye called the retina. This is the part of the eye that deals with eyesight. That's the part that actually sees when you're looking at something. So if that part is affected, maybe you get a bleed in the retina, it means you might get blurring of vision, or the worst case scenario, you get blindness. Then the ears, you can become deaf from hypertension. The mouth, you can lose your taste sensation from hypertension. We go further into the chest. If you bleed through one of the arteries around the heart that supply blood to the heart, the coronary arteries, you can have what is called sudden death. You can just die immediately. I actually had a colleague that I was working with who had a sudden death. They were watching a soccer match and all of a sudden their team was losing. Then they just collapsed and died. A postmortem was done. It revealed that they had a sudden death because of hypertension. So that's a major complication that can happen with high blood pressure. When you go further down in the abdomen, the kidneys, they are a major organ that is affected by high blood pressure. You get kidney failure, you get renal artery disease because of hypertension. And the kidneys, the problem is there's a cascade effect. The kidneys, when they are affected by BP, they go back and affect the BP and make the BP go further up. So the kidneys, when they get affected by hypertension, it's highly likely that the hypertension will become even worse when you've got kidney disease. We go further down to the perineum. High blood pressure can also cause impotence, erectile dysfunction. I have a number of patients that I put on medication to help them improve their erection because of hypertension. So hypertension can actually cause erectile dysfunction. Then we go further down to the lower limbs and the upper limbs. It affects your peripheral vasculature. That means if your vessels are damaged because of high blood pressure, you might get gangrene. Poor supply of blood to that peripheral part will result in that part of the body, of the arm or the limb, getting rotten, and you get what is called gangrenous necrosis. Once you get gangrene, we end up probably amputating that limb. It might be a toe or even the whole leg or even the whole lower limb. So those are the main complications of high blood pressure. Join us after the short break. We're going to be discussing the management and diagnosis of hypertension. Welcome back to the third segment of Dr. Joe. Today we're focusing on hypertension. We've discussed the definition of hypertension, the classification of hypertension, the pathophysiology of hypertension, and the complications of hypertension. Now in the third segment, let us look at how do you make a diagnosis of hypertension and how do you manage your diagnosis, your hypertension. One, the diagnosis of hypertension is purely by BP measurements. We measure your blood pressure using a sphygmomanometer. There is no other way that you can diagnose hypertension. You can't tell on your own that your BP is elevated without it being measured. On that note, we encourage people to buy their own sphygmomanometers, BP machines to use at home to measure blood pressure at home, because it has been proven scientifically that BP recordings that are done at home when someone is relaxed and resting in their comfort and environment is usually the best and the most indicative BP, because patients, when they come to doctors or go to hospitals, to clinics, they might have some pressure that might make the BP go a bit up compared to the BP they measure at home. So I encourage you, if you're already hypertensive, to definitely buy your own BP machine and measure your BP at home regularly. When you go visit your doctor, go back with the readings and show the doctor the readings that you've got. Now, before we go any further, let us demonstrate how to measure blood pressure. When it comes to blood pressure measurement, you need to use a sphygmomanometer. This little gadget is called a sphygmomanometer. When you take this sphygm, you put it on the arm. There are other sphygmomanometers that you use on the arm, then this one you use on the forearm. So we put the BP machine on the forearm, then we wrap it around, make sure it's tight, not too tight and not too loose, but tight enough. Then you press the on button, then it starts recording on its own. You just wait for it as it records. Coming to the management of hypertension. One, management of hypertension can either be medical or non-medical. We start with non-medical management. Non-medical management involves lifestyle changes. There are things that have been shown to cause elevation in blood pressure. One, salt intake. You need to reduce your salt intake. Salt contains sodium. The active ingredient in salt is sodium chloride. So that sodium in your salt will cause water retention that is going to result in elevated blood pressure. So we encourage you not to take too much salt. So what we say is the salt that has been put by whoever is cooking is just enough, and whoever is cooking should not put too much salt, so that people do not add salt as well when they are now eating. We do not encourage people to put salt. Two, on lifestyle changes, we encourage you to minimize or reduce the amount of fat you take. One, fat intake is reduced by by boiling your food instead of deep frying your food. So most of your food should be boiled instead of fried. 2, remove the fat from your food. Remove the skin from the chicken, remove the skin from the pork. If it's beef, prefer lean beef compared to fatty beef. So those are the main ways of reducing salt intake. Then thirdly, it has been proven that if you eat a lot of fruits, a lot of vegetables, it reduces your blood pressure. We say the amount of starch that you should eat in a meal should just be the size of your fist, or just if it's French fries, chips, just a handful of chips is enough for a meal. Then 2, when it comes to meat, reduce the amount of meat that you take. If it's chicken, just 1 piece is enough. If it's beef, we say 2 pieces of beef the size of a matchbox. And then when it's pork, it's the same applies, 2 sizes, 2 matchbox size of your pork. Then from there, let's go on to exercise. We encourage you to exercise as part of lifestyle changes. Exercise, we encourage you to do aerobic exercises or cardiac exercises more than weightlifting. It's better for you to walk, to jog, to run, to skip, buy a skipping rope and skip, buy a home cycle, you can cycle, or just a bicycle, cycle around. So those are the main exercises that we encourage. 1, walking. 2, jogging. 3, running, intensive running. 4, you can also buy a skipping rope and then you can skip. 5, you can buy a home cycle or a bicycle, you cycle around. Those are the main exercises that we encourage to minimize the accumulation of fat in your body. Then from these now, I want to move on to medical management. Medical management entails the usage of drugs. The main drugs that we use, if your BP is still fairly low, say between diastolic between 90 and 100 or at most to 110, we can use what are called diuretics. These are first-line drugs. If your systolic is also between 140 and 160, usually just use the diuretics. Examples of diuretics are thiazide diuretic. A good example of a thiazide diuretic is HCT, or hydrochlorothiazide. This is a common drug that we generally prescribe. It has been proven that HCT is quite good, especially for black patients, to reduce blood pressure, because most hypertensive black patients get their hypertension from fluid retention. There's too much fluid in their body. So when you give you diuretics, you diurese and you pass more urine and you lose more water, and generally through that, you reduce your blood pressure. There has been myths and people have been talking in the streets about HCT, and a lot of people say HCT causes diabetes. I want to clear that myth. It is a lie. HCT does not cause diabetes mellitus. Hypertension that is poorly controlled causes diabetes mellitus. If you're hypertensive, and one of the complications that you can get is a bleed in the pancreas. When you get a bleed in the pancreas, your pancreas stops functioning well. The pancreas is the organ that controls your blood sugar. So once the pancreas is not functioning well, you lose your control of your blood sugars and you suffer from diabetes mellitus. Note that HCT causes diabetes mellitus. So I want you to know that HCT does not cause diabetes mellitus. Then the other drug that we use as first-line drug is called atenolol. Atenolol is a beta blocker. It helps slow down the heart rate and to reduce the blood pressure. So in patients that present with palpitation, your heart is beating too fast, which is one of a symptom of high blood pressure. If your heart is beating too fast, it's best for us to put you on atenolol or beta blockers. And then from there, if your BP is continuously going up, say now it's greater than 160 on 160, more than 160, the top one, the bottom one more than 100, we might need to add another group of drugs. These are now second-line drugs. A good example is what are called calcium channel blockers. A good example of a calcium channel blocker that is commonly used is nifedipine. The other one is called amlodipine. So once you add the second drug, it means your BP has gone up, and with that, we need to manage your BP a bit more thorough and more aggressive. If your BP now goes beyond, to be systolic greater than 180, diastolic greater than 110, it means we now have to add another drug. At times, we put you on 3 drugs. Once you're on 3 drugs, it means your BP is now probably severe. Once it's severe, we manage you with a third-line drug. Then once we do that, we bring down your BP a bit lower. Then if your BP is not responding to these 3 drugs, if you are now on 3 drugs and your BP is not well managed, what we want to do is to put you on a 4th drug at times, or at times nowadays you get combinations to manage the BP. And at that point, we call your BP malignant hypertension. And once you've got malignant hypertension, it means you are in a severe case and you need good and thorough management and probably need admission into hospital. So now let's look at the tips for reducing your blood pressure or for managing your hypertension or preventing yourself from suffering from hypertension. 1, you need to exercise daily, at least 30 minutes a day. We say you should exercise at least 30 minutes a day, preferably doing aerobics or cardiac exercises, that is walking, jogging, skipping, or cycling. 2, reduce your salt intake in your diet. 3, reduce your fat intake in your diet. 4, increase intake of fruits and vegetables. Amongst the fruits, the best fruit for hypertensive patients is bananas because they contain potassium, which help lower down your blood pressure. Then lastly, if you are put on medication, please comply with the medication that you've been given by the doctor and take your medication. If you have any problem, be it a side effect or you think your BP is not well controlled or you think you're now healed, go back to the doctor and let the doctor tell you to stop taking your medication. But in general, once we put you on antihypertensive medication, you take them for life. Thank you for watching today's episode of Dr. Joe. Remember to like, share, and leave a comment. If there's a topic that you want us to discuss next, just indicate this topic you want us to discuss it next time. And also remember to follow us on Facebook, Dr. Joe 263, follow us on Twitter, Dr. Joe 263, follow us on Instagram, Dr. Joe 263, and also like droptv.com. Thank you.